So thanks everyone. Today there's a total of 79 active cases in Shepparton at the moment, and that's an increase of 15 new cases in the last 24-hour reporting period. Of those 15 new cases, 12 of those are linked to existing outbreaks or existing cases, and 3 are still under review. At the minute, across those 79 active cases, there's a total of 44 households that now have active cases in them in Shepparton. So the work of the contact tracing team is continuing, and they're moving as quickly as they can to interview people, talk with people. And again, I just encourage anyone who's contacted by not only our contact tracing team, but across the state, to please make sure you take the call and provide as much information as you can in order to help the contact tracing teams and the public health units to understand what's happening in terms of how the virus is being transmitted and where the risk areas would lie for other people in terms of trying to reduce the spread of COVID-19. Of course, as I always say, and as many others do as well, and we are still seeing some delays in people who have symptoms getting tested. So should you get any symptoms of COVID-19, no matter how mild they are, we want people to come forward and get tested straight away, and don't put it off. You know, even a couple of hours, every minute's really important in that case, and we want people as soon as they get the symptoms to come forward straight away and be tested. Another thing that we're really focused on at the moment is vaccination, of course, and this week's data is encouraging in terms of where we're placed within the Greater Shepparton local government area. So at the moment we have 89% of people who have had their first dose, and it is in the order of 52% who have had their second dose, which is great, and there's been some nice movement upwards in those numbers in the last few weeks, but we're not there yet, and we still have a little way to go. And certainly what we're seeing in terms of reaching the 80%, certainly the 70%, then the 80% double dose rate is really important, and we're obviously encouraging people to get vaccinated. If you haven't made an appointment, you need to do so straight away and get vaccinated as quickly as you can. What we are also seeing in terms of people who are unvaccinated is that across Victoria, in terms of hospitalisation, that's 81% of people who are in hospital with COVID-19 are not vaccinated, and then 91% of people who are in intensive care are not vaccinated either. So from that point of view, obviously vaccination is really important in terms of reducing the spread of COVID in the community, but if you're not vaccinated and you do catch COVID, the chances are you're going to become pretty sick, and you will end up in hospital at some point in time. So just coming back to the local circumstances in relation to Shepparton and where we're heading in terms of getting certainly our first dose numbers up as quickly as we can, and then the second dose numbers will flow from there. Quite simply, what we're really encouraging people who haven't been vaccinated is just to get the jab done. It's as simple as that. It's not a complicated thing. There's plenty of access to vaccination at the state-based hubs, and then also at general practice and community pharmacy. So we really want people just to get the jab done. It's not a hard thing to do. You can get in and out of your appointment usually with no more than 30 minutes, and getting the jab done is something that we can all do in terms of not only protecting your own health, but protecting the health of your loved ones and the broader community. We have at the Macintosh Centre today, we've just started, thanks to the Victorian Government, we've had an allocation of Moderna vaccines. So at the Macintosh Centre today, we're taking walk-in appointments for Moderna. You don't have to book online or on the phone, so people are able just to simply walk in for a vaccine of Moderna. And then also this Sunday will be open for vaccination for Moderna vaccines only. The Moderna vaccine in broad sense is very similar to the Pfizer vaccine. It's able to be used for people from aged 12 up to 59 years of age. So again, plenty of access right across the state in terms of vaccination. So please just get the jab done, and it's going to benefit not only you but the broader community as well. So thank you. Happy to take some questions.
In terms of this outbreak, with the majority of cases linked, does that give you more confidence that we're starting to get this under wraps?
It's encouraging. I think, yes, we did see, in terms of how the transmissions occurred, there was some movement between households, which we've spoken about before, and some gatherings of other people. We know in one instance there's been a grand final party, and some other times where people have come together for different social reasons. But to be able to link, say, as I said before, 12 of those cases so quickly, the new cases of 15 in the last 24 hours is good. But again, we just encourage people not to be moving around, and to unless you've got a permitted reason to go to someone's house, please don't do so.
Do you have any idea when cases will begin to slow?
It's at the moment with Delta, what we're seeing is that people, once it has one household member testing positive, it moves very quickly through the rest of the household. So the fact that we're still seeing the numbers in and around, 15 new cases in the last 24 hours, and we know already today there's a small number, a handful of other positive cases again today, which will be reported in total tomorrow. So when those numbers start to decline in a more consistent way, we'd probably be more comfortable, but just at the moment, not as comfortable as we'd like to be.
Looking towards, I know it's not your call to make, but in terms of looking towards potentially lockdown ending, will it be a case number thing, or will it be the cases of how many of them are linked and unlinked and in new households, which will determine whether or not lockdown restrictions ease?
In part, it'll be all of those factors in terms of the lockdown decision, but that's really a matter for the Chief Health Officer's office and his team. But they will look at not only total case numbers, but the number of new cases in recent days, and the number of new cases in particular, and also some of the higher risk settings where those cases may be placed as well.
We know that vaccination rates also played a big part. Obviously, this time around the vaccination rate in Shepparton is much higher. Do you expect that to play a part in hopefully bringing this under wraps quicker?
So as I said before, we know that the rate of hospitalisation for people that are unvaccinated is much greater. The higher rates of vaccination more broadly are linked to the roadmap, and I note that the Premier's made comments in the last day or two that he hasn't received any advice that won't change things in terms of Victoria's progression along the roadmap. So I think the vaccination rates are encouraging, but like a lot of things, and as I mentioned before, usually it's that last 5 to 10%, no matter what you might be doing, that is the hardest part to close out, and that's why getting the jab done is really important for those people who haven't yet been vaccinated or made an appointment to be vaccinated.
In terms of exposure sites, people are posting comments, giving feedback to us that we might not be getting as many tier 2. Can you explain a little bit of the thinking behind that?
Yeah, so what we know in relation to tier 2 exposure sites and why they're not being published as frequently currently as they have in the past is that the rates of transmission in terms of tier 2 sites is very low now. In the past it was a bit higher, and therefore it was more of a concern, but what the contact tracing teams are actually doing is focusing on that initial interview particularly with a new positive case, to understand where they've been and understanding what the risk might be in relation to that, and then posting information about tier 1 sites from there, or higher risk locations. So the way forward is really going to be, and Paul Johnson in our community forum commented on this the other night, I think the community needs to understand that it will be more of a citizen-led approach. I think they were the exact words. It's a citizens virus now, and particularly as we start to emerge out of in terms of the roadmap, and emerge out of lockdown and more broader easing of restrictions, that we can expect to see people once they've been notified that they're positive, sharing information on social media platforms or through their employer. And it's likely that the community might hear about positive cases in different locations where positive cases have been, and that's okay, because as we know with the modelling of the Burnet Institute, is that there's going to be an increased number of cases in terms of what those projections and that modelling is showing us. So having that information shared through employers or friend or family networks, I think is okay, because what we really want people to do under those circumstances in those lower risk areas is that if they have been in contact with someone who has been who is positive, I think we all know what to do now. We've got to get a test. Definitely if you're symptomatic at any time, whether you're vaccinated, including people who are vaccinated, we want you to go and get a test straight away. So we do know, a bit like influenza, that people who have the flu vax can still catch the flu. It's going to continue to be the same in the coming few months in terms of people who for whatever reason have the symptoms. You still need to get tested straight away, because that gives us good information about what's happening. But in relation to the Tier 2 sites and the Tier 3 sites, there'll be less information published about that, but certainly people should keep an eye on the exposure sites for the Tier 1 and the high risk locations, because they'll continue to be shared with the community across the state.
Will all of those Tier 1 sites still be listed, or will some of them say, like a doctor's surgery where there are 5 people plus employees and they know all 5 people there? Will that information still be shared publicly, or will that be made just the 5 people contacted? It doesn't need to gum up the rest of the online system. How will those really, highly controlled, highly concentrated Tier 1 sites work?
Yeah, so smaller and lower risk, smaller Tier 1 sites, well really I'll take a step back. Probably the best way to sort of explain it is that if where there's a higher risk site and it is a Tier 1 site, the work of the contact tracers, and once the new case is identified, is to quickly do those interviews, ascertain the risk and understand how quickly the rest of the people in that location can be notified. And then if it's a small number of people and that information's readily available, and those people can be contacted quickly and brought forward for testing, it's unlikely in that case it may be published, even if it is a Tier 1 site. If it is a higher risk Tier 1 site, then it will be published, and where that information may not be as strongly held or as clear about who's been in that particular venue at what particular times, that's where there's a greater level of risk, and then that information will be published and shared with the community. But it's really about moving quickly and using the resources we have available to be on top of things and get people to come forward to be tested. It's a risk-based approach that we're now entering into.
So to be completely clear, if somebody's contacted by a contact tracer and they're told, you're at a Tier 1 site, you still need to do the isolation for 14 days. It doesn't matter that it's not listed online.
Yes, any contact, any formal and official contact by telephone, like a phone call, or by text message, will only still come from the contact tracing teams, whether that be the local public health units or the Department of Health as well. And people really need to pay attention to those messages and take those calls.
Is there an update on the number of people admitted to hospital at the moment with COVID?
Yes, we have currently 8 patients admitted at GV Health, and we've had anywhere from 6 to 9 or 10 in recent days, and it's pretty similar to what we saw back in August and September in terms of that rate of conversion of around about 8 to 10% of the total active cases in the area, people requiring admission from there.
Has anyone been taken to Melbourne?
Not in the last 1 or 2 days. In fact, in this most recent outbreak, we haven't transferred any patients to Melbourne, as opposed to what happened in August and September.
Is that because the cases have been less serious so far this outbreak, or is it because you guys have just taken more on in terms of the treatment region?
No, it's more just about how unwell the individual people are, and sometimes it can be that you have people who are already unwell with other chronic or complex disease that once they get COVID, they become unwell even more so, and they require higher levels of care beyond what our intensive care unit can provide. But fortunately, we haven't seen that in the last few days.
Are you concerned that rising numbers in Melbourne mean that there might not be the ability or the capacity in Melbourne to transfer people down to Melbourne? And if so, what's the next move for you guys?
Well, there's other capacity not only in Melbourne. There's hospitals around regional Victoria, Geelong, although Geelong's, I appreciate its close proximity to Melbourne, but some of the other regional hospitals are taking COVID patients as well, and it's a fairly well linked and networked system, the public hospital system. So I think there's enough capacity at the moment for patients requiring general ward care and intensive care.
The state government announced they're going to purchase more than 2 million rapid antigen testing to be used in health services once we kind of get on to that November 1 stage. Do you see that as a big part of what you'll be using going forward?
In terms of staff surveillance?
Yeah.
Yeah, so we do use some rapid saliva testing already for staff in high risk areas, and that's primarily at the moment in relation to surveillance testing programs. So and the reason why we do that is there is an awareness, I guess, and evidence that despite full PPE and N95 masks in high risk areas like our ED or respiratory ward, for example, there has been times where staff across Victoria have contracted COVID. So, but they've been asymptomatic, which is a bit of a challenge. So, the surveillance testing we've had in place since would have been late August, early September, is really built around that to give staff and us comfort in terms of the saliva testing program, that we're asking them to be tested every few days to provide that extra level of surety to look after their health and well-being, but also from a patient care point of view as well.
There have been some exposure sites up in Namurka and Nathalia, and the 2 cases in Moira today as well. Do you have any information about them and whether or not they're linked to Shepparton?
One case is linked to Shepparton and one case is of an unknown origin, and that's probably a good example of how the tier and the exposure sites are working now. So because that case, I understand it's a library and a pub, a hotel that's been listed, because that is an unknown transmission and the contact tracing team are concerned about it, well, those 2 venues in particular have been listed, and that's what we should expect how the tier rating and the notification system will work, is where there's unknown transmission and we're not sure about how that person's contracted it. That's where the request will be for other people to come forward to be tested, as opposed to a more tighter group or smaller number of people in a particular location that is still high risk.
Yeah, were they isolating during their infectious period up in Moira, do you know? Or?
No, I don't believe they were in isolation, and that's why those 2 venues where there's high volumes of people moving through those sites.
Yeah, but in Tatura, have there been any more cases in Tatura? Were the 15 cases in Greater Shepparton or just Shepparton itself?
There's one more case in Tatura, and that work is being done in terms of the interviews with the person concerned.
Is that the same household as the other case, do you know?
I'm not sure if they're in the same household, but I understand it looks like they may be linked at this stage, but that's still the work that's underway.
And that Tatura case, is that in today's numbers or recent
Probably
days?
be tomorrow's numbers, yeah. But there have been some other cases in Tatura in recent days.
Do you know the total active cases down at the moment?
At Tatura, not offhand, but we can provide that tomorrow for sure.